Welcome to Taking Stock. I'm Amanda Lang. Coming up on the show, an in-depth look at healthcare in Canada, the good, the bad, and the overpriced children's Advil, including do the dollars we spend on healthcare equal decent care, and why drug shortages are predictable in Canada, plus how modernizing our system might make all the difference if only we could get everyone to agree. That's all ahead. First, though, Canadians have historically been proud of our system of healthcare, which promotes universal access and equality. But when it comes to what we spend versus the quality of care, it's not such a rosy picture. Here's a look by the numbers. Spend, we certainly do plenty of. Total health spending is forecast to hit $331 billion this year. That's $800,563 for every Canadian. It's a lot, though not the biggest in the world. That honor falls to the United States at more than $15,000 a head, followed by Germany and the Netherlands. Canada is the fourth heaviest spender. Interesting to note, though, that spending a lot doesn't translate into top quality care. Canada ranks poorly on international measures. A 2021 Commonwealth Fund ranking of 11 countries had Canada at number 10 in equity and healthcare outcomes. In last place, the big spending USA. Access was also a bad score for Canada, with 60% of Canadians reporting difficulty accessing care. And wait times, which have got a lot of attention in this country, got worse than ever in recent years, hitting 25.6 weeks for medical treatment, up from 9.3 weeks in the early 90s. One place many feel the shortage is family doctors. In 2021, there were 2.4 GPs per 1,000 Canadians, a number that has only gotten worse with population growth and doctors retiring post-pandemic. All of this adds up to a little bloom off the rose. Polling this fall showed that more than half of Canadians doubt they could get the care they need in a health crisis. Well, it does seem that what we spend on healthcare doesn't really turn into results. So what is the best way to improve the system? Bacchus Barua is director of the Centre for Health Policy Studies at the Fraser Institute. Great to have you with us.
Thank you so much for having me on the show.
And the Fraser Institute has done a lot of this research over time, tracking the results. So you know firsthand that we aren't necessarily getting the quality you might think for the dollars invested. Do things come to mind for you, Bacchus, that we might do differently in order to get better results with what we already have?
You know, we're in a very difficult situation right now. We have overcrowded ERs, we have burned out nurses, and we have a relative scarcity of physicians and beds per capita. One of the things that we've been doing for a really long time is looking at the data, and over the last 5-6 years, we continuously look at Canada compared to other countries with universal healthcare. And what we find is that Canada routinely ranks amongst the top spenders when we look at countries with universal healthcare. That means excluding the United States. In terms of per capita spending, we're 8th highest. In terms of spending as a percentage of GDP, we were actually the highest in 2020. And yet we have some of the fewest physicians, ranking 28th out of 30 in terms of physicians. We have some of the fewest beds, ranking 23rd out of 28. And we have relative scarcity of MRI and CT scanners as well. And of course, some of the longest wait times. The obvious question is, of course, what needs to be done? And the beginning, I think, is to start looking at other countries with universal healthcare that do a better job, that have a better balance of what they're spending versus what they get in return. And we can see very clearly about where we should be looking. These are countries like Switzerland, Germany, the Netherlands, Australia. All of them have universal healthcare systems. All of them, of course, are struggling with similar challenges right now, but they have more resources and they certainly have shorter wait times. That's where I would start looking for answers.
And what are some of the answers that come to mind when we do look at places like Germany or the Netherlands?
You know, we didn't look at it in this particular study, but we've done a lot of research looking at each of these specific countries. And there are really three key themes that we see. The first is their attitude towards the private sector. Even though these are universal healthcare systems, they all generally either partner with the private healthcare system or that they look at it as a sort of pressure valve to help alleviate some of the pressure on the public system. But they are looking at it as a tool to actually reach the goal of universal healthcare. The second thing that they do differently is that they fund their hospitals very differently. They fund them according to activity, and that actually incentivizes hospitals to treat more patients. In Canada, we're still stuck in a very old global budgeting approach, which essentially makes hospitals see patients as a cost. Every time a patient comes in, they're eating into that budget, and it's incentivizing the hospital to, worry about every time they get a patient. And the third is that, even though they are universal healthcare systems, generally, most of them expect patients to share in the cost of treatment. Of course, there are exemptions for vulnerable populations, as well as exemptions for those with financial challenges. Yeah. But they understand that, you need to help patients understand that these are scarce resources that need to be used responsibly. So those are kind of the three big differences between the top performers in Canada.
So big picture, it's always tempting to say just do better with the money you already have, but that's sort of what one is tempted to say about healthcare. Could we do better with the money we're already spending? It sounds like what you're saying is we could if we rethought how it was deployed.
Yeah, one thing's for sure. I mean, we can't use the same approach and expect different results. We have to do something differently. And I think it's one of the unfortunate things that we have is that we look at Canada compared to the United States, and they're just two vastly different systems and makes people very worried about change. Instead, we have a world to look at, seeing how these other countries do it. And of course, we'd have to figure it out in a Canadian approach. But unless we are willing to look fundamentally at changing our healthcare system, I think we're ultimately going to end up with the same problems in the future. And right now, the pandemic has really just exacerbated these very key structural issues that have existed for a very long time.
Just this week, we have doctors in Ontario suggesting for-profit surgery sites that would help take some of the pressure off hospitals. This is a kind of a third rail in this country. People get very upset at the idea of a for-profit part of healthcare. Do you see that as part of a potential solution, or is that something to avoid?
Well, I think it's already been part of a solution if we look at provinces like Saskatchewan, where we had the Saskatchewan Surgical Initiative that helped take the province from having some of the longest wait times to having some of the shortest by 2014. Of course, they also did other things. They did things like centralizing bookings so that you could pool referrals and get the specialists for the shortest wait time. But that was really thinking outside the box, but still within the context of the Canada Health Act. But I think, it's just unfortunate that we're having this conversation in almost a desperate situation. I would hope that, we take these lessons and look at it in a more calm manner in the future. But right now, one thing's clear: we can't expect things to get better while doing exactly the same thing. And there isn't much more money that we can pump and spend into the system. We're already right at the top. We have to think about doing healthcare differently so that it actually helps patients and actually achieve that universal promise that we hold so dear to our hearts.
Bacchus, so good to have you. Appreciate your time.
Thank you for discussing this critical topic.
Bacchus Brua is director of the Centre for Health Policy Studies at the Fraser Institute. Coming up, drug shortages are hardly new in Canada, and they may be far from over. Stay with us.